Hello, my name is Curtis Lee, and I'd like to thank you for the opportunity to discuss how my previous and current research interests will align with those being pursued at the University of Newcastle's School of Psychology. The focus of my PhD work explored the psychometric determination of levels of professional competency in health professions. I've expanded on this work to the assessment of competencies at the time of completion of training, the determination of what makes up competence, and how to determine gaps in abilities to assure that professionals completing their training are safe and capable practitioners. As a former research associate and senior psychometrician with the Royal College of Physicians and Surgeons of Canada, I helped establish the system currently used to assess the competency of medical specialists through their certification. I held this position for 10 years prior to coming to Australia. At the Royal College, despite not being required or even permitted to publish on our considerably rich database containing over 40 medical specialist exams held each year, I maintained a number of collaborative research relationships with sister organizations and academics from a number of universities across Canada, resulting in several successful research projects and publications, and I have started to do the same in Australia. Most recently, I've collaborated with colleagues from across the University of Newcastle, including some at the Hunter Medical Research Institute, Monash University, and several certification bodies in Melbourne and Canberra. In Canada, I became one of the University of Ottawa's inaugural research associates for AIM, the Academy for Innovation in Medical Education. This group was created to guide strategic development of research projects and foster the growth of a medical education program. My role as the educational scientist resulted in several publications and conference presentations and helped many physicians start their academic careers in medical education. Through these associations, I've helped develop and improve instruments assessing the learning and evaluation of professional skills such as communication. One tool in particular was a psychometrically tested evaluation tool that examines how medical residents perform across their internships. This resulted in a 2008 publication in Medical Education. Some of the other projects that I've worked on involve examining traits of what make up valid and reliable programs in emergency medicine, the impact of rural and remote training sessions, and national curriculum reviews. My master's research related to the efficacy of using multimedia for learning, and I also have experience with exploring the effectiveness of online learning through my teaching, and I hope to pursue this research if time and resources allow. My expertise in current models of psychometric analysis allows me to undertake and contribute to a broad range of research endeavors through the application of appropriate psychometric methodologies, such as item response theory, like Roche modeling, and generalizability theory. Core to many complex research activities in psychology is assurance of the psychometric soundness of the metrics used to measure variables. This skill can enhance any research activities that utilize instruments to assess behavior and opens up a new potential for additional and complementary research. For example, as you know, the Personal Qualities Assessment Tool, or PQA, that was developed here by Miles Bohr and others, is currently being administered worldwide for the selection of medical students. I would love to help provide a retrospective analysis of the PQA in order to revisit the success of this tool both locally and internationally, in order to confirm its predictability in terms of students' outcomes and professional behavior. Beyond this, I think that we can build on this research to follow these students into medical practice and determine if the PQA could be the first step to a more longitudinal medical competence model. I would also like to explore a psychometric perspective to complement the outstanding mathematical psychology work done at the School of Psychology by the Human Experimental and Applied Dynamics Research Group. I believe that psychometrics can help contribute to the development of tools that can be further used to validate the models that have been created. I also understand that the university has committed to promote synergy between the School of Psychology and the HMRI, especially with regard to cognitive science and neuroscience research, and I believe that I can help foster this link. I currently have a conjoint appointment with the School of Medicine here in the JMP, the Joint Medical Program, shared by the University of Newcastle and the University of New England. And through this, I've started to establish a relationship with several faculty at the HMRI. This includes initial work with Brian Kelly exploring the issues around selection of medical students, and with Kichu Nair on the validity and reliability of work-based assessments of international students. Since arriving in Australia 2 years ago, I've been primarily focusing on teaching statistics and psychometrics, but I've maintained and developed collaborative research contacts internationally and within Australia. Internationally, I still collaborate with my emergency medicine colleagues at the University of Ottawa, and I'm working on a few projects, including the exploration of the effect of circadian rhythms on shift work and modifying the curriculum to enhance how effective M&M rounds are for residents based on assessments of their behaviors. I've also started to work with a colleague from Monash to explore the psychometric effectiveness of their performance-based assessments. Although in the early stages, I hope that this collaboration will help determine the development of expertise in areas like communication and ethical behavior that will lead to the development of competent professionals. I also possess other research-related skills that will help me quickly contribute to the research activities in psychology. During my work at the Royal College, I reviewed several hundred national research grant applications and therefore know how to develop effective funding applications. This experience helped me acquire skills in developing sound project budgets, going through the process of developing ethics proposals, and ensuring that the methodology is sound, well documented, and persuasive. I have applied this experience to the creation of several successful funding and research applications. Recently, I collaborated with Rohan Razaya to apply for an OLT grant about assessing methods of communication among pharmacists for the Bachelor of Pharmacy program. Although we did not receive the grant, we did receive positive feedback and look forward to trying again with him next year with modifications. I look forward into building on the projects that I'm currently working on and collaborating with others in the School of Psychology into developing my own research portfolio in the area of competence. I'm also interested in researching the effects of test anxiety and performance, the assessment of latent professional competencies such as ethics, communication, and organization. Given the work currently done with the PQA, mathematical psychologists in the cognition lab, and growing initiatives with HMRI, as an experienced psychometrician, I believe that I'll have the resources, skills, and expertise to quickly establish a productive research portfolio and expand my network of collaborators. I look forward to forging strong research partnerships with both within the School of Psychology and together with other Australian universities and with our international colleagues. Again, I thank you for the opportunity for creating this video and allowing me to talk about my research interests. I look forward to meeting with you in person to discuss any of the points covered in this video. Again, thank you.